Eric Olson, KSMQ Public Television, with you on cue. And queuing up today, Mower County Public Health Nurse, Pam Kellogg. Welcome back again.
Thank you.
We're running here towards the end of March. And what's the latest from Mower County Public Health and COVID-19?
Well, as of today, Friday the 27th, we have 10 cases in Mower County. And we are notified every day from the Department of Health if we have additional cases.
And what are you doing? There's different levels, right, of being either in quarantine or there's other levels, other words that I'm hearing. Can you explain that to folks? Because there's a lot of confusion there, I think.
So quarantine means that you do not have COVID-19. You just may have an exposure. And so you're being asked to stay home, and the quarantine is 14 days. Whereas isolation is you have been either lab confirmed or clinically confirmed to have COVID-19. That means you need to self-isolate even from family members, and that isolation is at least 7 days and an additional 3 days of no fever, whichever is longer.
And you can find the symptoms anywhere on the internet, I suppose, but ksmq.org, we have a link to the public Minnesota Department of Health, which has that on there. That hasn't changed, right?
Nope.
What you should look for?
No, it has not changed. It's that cough. The fever is the big concerning one, and a fever is considered anything higher than 100.4.
Okay. And then if they positive test, now you'll have to tell me how to even go get a test, because we're not supposed to call our doctor unless it's really urgent, right?
Well, if you feel that you are coming down with symptoms, you are to call your healthcare provider. The nurse line at Mayo Clinic, if that's where you doctor, and the nurse will triage, ask you questions to determine if you should be tested, and then they will give you directions there. Testing in Austin and Albert Lee and Rochester are being done through drive-through clinics.
Okay.
If you test positive, the provider will give you a call and give you instructions to start self-isolating. Then the provider will notify the Minnesota Department of Health, and then the Department of Health will contact the patient that has the positive test, do a thorough interview to determine if there's been any exposures, and if there's been exposures, they will continue on contacting those people and giving them instructions.
Okay. And Mower County Health's role and just county public health services role in all this, because you folks are really, I think, the heroes of some of this work coming in and doing this. What's your role in all this as a county?
So for local public health at this time, we are the ones that provide essential services. So if someone is in quarantine by the Department of Health or is in isolation and they need some like groceries, prescription medication, that request goes up to the Department of Health, which then comes down to local public health, and we provide those services for them.
So going
We
wherever.
bring it to their home, yes,
Okay.
wherever they're isolated.
And this would be a good time to unveil your phone number, because folks, as you can imagine, all of us are interested in this topic. It's top of mind everywhere, and so people are calling with good questions or information. They need this information or something to help, and you all have set up a phone line for Mower County Public Health, 507-396-8227, Essential Needs Request Line. Talk about that.
And that actually is not for public health, it's actually our emergency management with the county. We have 3 emergency managers that work for us that collaborate with all of our EMS and fire and volunteer departments. They have set up this hotline that if you have questions or you have needs that you're unable to get out of your home, or you have questions regarding COVID or the governor's order, you can call this line, leave a message, and they will see if they can meet their needs and give you a call back.
So that number again is 507-396-8227, Mower County residents,
Yes.
right? And so they should still call your office, though, for other questions?
If they have questions, you certainly can call Mower County Health and Human Services, and we'll be more than try to answer those questions.
But your role really is also part of a state. The county has a role when the governor puts out edicts or recommendations, then it's up to you to make it happen. Sort of.
I mean, we're certainly not enforcing anyone. Everybody is following the orders that the governor. That's one good thing about Minnesotans. We listen to the directions given by the governor. But yes, we have our marching orders as far as how do we respond to a pandemic.
And public health's role is right in there. I mean, what
Correct.
you're doing, as opposed to like the clinic.
Correct, yep. Eventually, the Department of Health may become bombarded with cases, and then it will go down to local public health. We may have to start doing contact investigations sometime down the road.
Because the governor said the other day, and he has good information, but he estimated, I think he said 40 to 80% of residents may eventually have this.
The good news is, of those that get it, 81% is very mild, recovers very quickly. It's just a few that end up becoming critical.
That's great to hear.
Yeah.
And people are making do and getting things done. My mom is going to have her 98th birthday at her home where she lives, and the family is going to gather outside her window, outside in the snow. Hopefully the snow will be gone, to sing, and the grandkids will be there to sing to her at the window, but they can't come in and see her.
Yeah. I've seen that on quite a few different things. People are doing that. We're coming up with neat ideas on how to do social isolation.
97, not 98. I got that right. Wrong. Sorry, Mom. Okay. Pam Kellogg, Mower County Public Health, thank you very much.
Thank you.
For joining us on Q. And again, that phone number, one more time, 507-396-8227. That's the Essential Needs Request Line from Mower County Emergency Services. KSMQ.org, that's where you'll find these videos as well as links to the latest information. For now, I'm Eric Olson. Thank you.